Okay, and good morning. Welcome to today's conversation. Quickly tell us where you're watching us from so we know where you're watching us from. We are quite interested to know where you're catching us from. Today, we are discussing a very interesting topic. We thought we'd deal with this one because one of you asked us to address it. It's the issue related to headache. But in this particular instance, we are discussing a specific type of headache. We are looking at migraine headache and what are the issues related to the same. Um, so, migraine. Now, um, first of all, let's get a few things out of the way. Migraine is a type of primary headaches. Now, there are other types of primary headaches that you will find. Headaches like tension headache, cluster headache, those are considered primary headaches together with migraine. Now, a lot of questions arise with regards to migraine and what is it? Can it be cured? Can it be controlled? What are the issues that relate to migraine? So those are the issues that we're going to discuss today. So now, migraine with regards to say symptoms. Migraine usually, in most cases, is a type of headache that you will find would attack a person and it would affect one side of the head. Sometimes that it may affect both sides of the head, but typically it will affect one side of the head. And the headache may last a few hours to 3 to 4 days. Continuous headache may last for 3 hours to 3 to 4 days. And characteristically, the headache or the characteristics of the headache in someone who has migraine is that the headache starts slowly and starts building up bit by bit until it reaches the maximum, which in medical language we call crescendo. And it will stay at that maximum for some time. And one of the things that you will find about migraine is that when someone is attacked with a migraine, it really disrupts their lives. It changes their life completely. They cannot do anything. And usually people who have migraines don't like noise places. They don't tolerate light very well. So you find that they like to be in dark rooms because light makes it worse. And too much noise also makes it worse. Now, who is affected by headache, by migraine? In what sort of people do you find migraine? And that is also related to, when we start discussing what are the causes and what are the types of migraine. So generally speaking, you will find that migraine in children or in younger people or in children before puberty, migraine affects mainly boys. Whereas after puberty, migraine affects mainly women. So you will find that now that takes us into the conversation that, into answering the question that relates to cause. What causes migraine? I mean, how does migraine come about? So you'll find that there are factors that have been associated with migraine, or rather thought to cause migraine. One of them has to do with family. You'll find that there are some types of migraine, as we will discuss, you will find that run in families, where you find that if there's a close relative who had migraine, then you may also have migraine because your close relative has migraine, and that's how come you also have migraine. Either your mother, your father had migraine, you end up with migraine as well. Now, there's a specific type of migraine that actually runs in families. When we discuss the types, you will see which one. The other cause for migraine that has been discussed extensively has to do with hormones. Different hormones in our bodies, you'll find that as they increase in our bodies and certain hormones as they reduce also can potentiate migraine. Here's why the theory around hormones is quite strong, is that it has been observed that people who have migraines, when they fall pregnant and certain hormones reduce, you'll find that they don't get as many attacks of migraine during pregnancy. And also, women during menopause, if they were suffering from migraine, you'll find that as they reach menopause, migraines also, the frequency of attacks goes really significantly down and sometimes even completely goes away. So that's what. And then also the other reason that has been advanced in terms of cause is the environment in which you live. All right. For example, it's been said that if you don't have good ventilation, or there's too much light or less light, or just your environment in general can actually have a problem on migraine. Now, here I'm discussing the causes. We'll talk about the triggers of migraine later on. So, in somebody who is already susceptible to migraine, what would trigger the headache? Different things have been discussed, but we'll discuss that later. For now, let's look at the different types of migraine that are there. Now, the different types of migraine that are there, you have one type of migraine which is said to be migraine without aura. Now, this is a common migraine. Now, let me explain something very clear here. I said migraine without aura. Now, some of you have quickly asked me, doctor, so what is aura? So let me tell you what aura is. Aura is a sense or a feeling that someone who's already suffering from migraine usually gets before the attack comes. They either get a funny smell and they know it, that when I get this funny smell, or they see things, or when I see something like this, or when I get deja vu, I get an attack of migraine. So aura is sometimes they may get nausea or they may vomit before the headache comes. So now that's aura. Now in some people, they will have a headache or they will have migraine without any of those feelings, and that is called migraine without aura. Now, there are people who also have migraines who get migraine attacks and they get a warning sign before the migraine, and that type of migraine is called classic migraine. Because it's called classic in the sense that it has like a warning sign before the attack comes. It has aura. It's also called migraine with aura. Now, it is the migraine with aura which is said to be familial, because that's the one that runs in families. That's the one you inherit from your relatives. All right. So even you, if you have migraine with aura, as you have children, don't be surprised if one of your children gets migraine, because it runs in families, and there's a change in the genes that makes you, susceptible to that type of migraine. Now, there's another type of migraine which comes with a weakness in the hand. There are some people who would have a migraine and they have a weakness in the hand or in the leg, or some funny sensation in the hand, or even a weakness or pain in the hand as well. There are some people who may have a migraine, but it's also associated with abdominal pain. All right. There is also migraine where you have a migraine and it's also disturbing your eyes. So you have a migraine, but again, you can't see properly. And then you have people who have migraine, it's also maybe disturbing their balance, or they are unable to balance properly, or they hear sounds, or they hear very funny sounds in their ears as they are getting the migraine. So migraine can do that to some people. So it depends on what type of migraine you have. Now, with regards to triggers, so what would make you get an attack of migraine? So now, for different people, the triggers are different. Understand that for different people, the triggers are different. There are some people who would be triggered to get into a migraine by certain types of food. Chocolate, for example, milk products, preserved meat, for example, can also trigger migraines in some people. Now, why are triggers important? If you have a migraine, or if you suffer from migraine, why should you pay attention to triggers? You need to pay attention to triggers purely because you need to, part of managing migraine is you avoiding those triggers. So if your migraine is triggered by a specific thing, just pay attention to those triggers and avoid them. All right. Some people they are triggered by alcohol. So you take alcohol, you trigger a migraine. Now, different people have different triggers. Just pay attention to what triggers your migraine. Some people, flickering lights. That you find that there are certain people who have migraines who can't even go out to a disco because the flickering of light can actually trigger their migraine. So they avoid that. So for you specifically, just pay attention. What is triggering your migraine? And pay attention to that. Okay. Now, treatment. How do you treat a migraine? Now, migraine, in terms of treatment, it depends on how severe the migraine is, and also what type of migraine you have, and also the frequency of attacks. How many attacks do you get, say, in a year? How many attacks do you get in 6 months? How many attacks do you get in 3 months? So the frequency of your attacks will determine how you will be treated. So the approach to treating migraine is that, first of all, your doctors need to understand what triggers your migraine, first of all, because that becomes important. If a patient can identify their triggers and they're able to avoid their triggers, they may avoid certain interventions. The other issue to look into is if we identify your triggers, and then the first line of treatment for migraine is they'll just give you a simple painkiller. They are drugs that we give to just relieve the pain. Simple painkillers, your Panadols, your Brufens, your Brustans, those. If those fail, there's another class of drugs you can be given. There is also another class of drugs you can be given to prevent attacks. So it depends on how you have presented to your doctor and what stage of treatment you have reached. But again, the success in treating migraine is a patient who is very informed. If you as a patient, you are very informed about the disease, it really helps. And also, the success also depends on the cooperation of the patient. For example, you are able to identify the triggers and be able to take your drugs on time and correctly. But otherwise, the challenge you have with migraine is that it's a very debilitating disease. When you see somebody attacked by migraine, their lives really get very disrupted. They're unable to work, they're unable to do anything. So really just bear in mind that migraine is a debilitating disease. But here's the silver lining. Here's what is even more interesting, is that migraine can be controlled. You can control it, cooperate with your doctors, it can be controlled. So this is what we thought that we share with you this morning on the subject of migraine. Let me see if we have any few questions that we can take in the time that we have. We've been talking for about 13 minutes. We have another 5 minutes to talk. Let's see if we have questions. Then we call it a day. Questions on migraine. Okay, looks like there's no question here, which is good also. Which is good if there's no question. Excellent. All right, so I can't see any question. It's a good sign. So it means that you have all understood. There are two possibilities. When there are no questions, there are two possibilities. Either my explanation was very easy to follow and all of you have understood, or I've just confused you completely that you don't even know where to start from. But I prefer to take the first one, meaning that the explanation was so easy and you have all understood, which is the goal of this page. Now, do us a favor. If you follow this page, or if you're one of the followers of this page, it means that you are our partner in our mission to achieve a state of healthy and prosperous citizens. So do your duty as a member of this page, share this video as widely as you can, because we need this information out there. For healthy and prosperous citizens, this has been Dr. Mjajati discussing a specific question on migraine. We will see you later in the day with another exciting topic. Stay blessed and